Broadcast is now starting. All attendees are in listen-only mode.
Hi, everyone. Thank you for joining us today for our April Info Share. We have a lot of awesome topics to cover today, and we're joined by both John Lee and Tony. Maureen's in the background, and Cassandra Lynch, and we wanted to introduce our new Living Well grant specialist, Anna Williams. Hi, Anna. And she's joining us, and she's in Fairbanks. Just some quick reminders about GoTo. If something happens and you lose your audio, you can chat into the questions box and say, I can't hear anything. Or if you see that the screen's frozen, let us know. It might just be you. And if that's the case, Cassandra Lynch in the background will probably give you some instructions. Or it might be us and we might need to reset. And if that happens, either one of the either Cassandra will pick up or we may all have to come back into the session. But we're hoping everything should be fine. If you would like to get the most out of your training experience today, use your questions box to type into it. If you want to go ahead and practice that right now, it's located within your webinar controls. There's an orange box with a white arrow that collapses and expands, and you can type into the question box. Looks like you guys are getting it. I just want to let you all know today during the course of our discussions, we'll be capturing all of your comments, questions, and all of your feedback. We may not be able to get to all of it as we go through our discussion, but we're using this platform because then we can pull it easily out for review later, okay? So if for whatever reason your question doesn't get specifically asked, know that it's been logged, all right? So because your feedback is really important to us. Before we turn the floor completely over to John and Tony, I wanted to do a couple of quick announcements. The first big one is about the Full Lives Conference. It's coming up really quickly, and we really would love for you to register. I'm going to drop into the chat box the link to the registration. So please feel free to check that out. I'll make sure it gets sent to everybody. And I'll pull up the website for you all. This is the website that it looks like. You have an opportunity as a care coordinator to get some CEHs. In your handout, there is a document that also has the link to this conference. You can get CEHs by participating in the entire conference. You need to register for it. And then after you attend each session, you need to complete the survey and download the certificate of attendance, and you'll receive your 16 hours of CEH once we have verified your participation. If you're renewing care coordinator, right, and you need to do your renewal training, please consider first registering for the conference and then send the training inbox a quick email saying, I would like the renewal assignment. And then you can complete this assignment within 2 weeks to have your renewal certification complete. It's not a really hard assignment. It's to really get you to engage with the materials and think about how you can apply some of the sessions to your profession and how it can help you be a better care coordinator. So this is in your handouts and you'll get it emailed to you today. I'm going to jump back to our agenda. There's a couple of other quick items we want to remind you of. Remember that we had our last info share was about the new applications for NFLOC 04 and NFLOC 06. Those are up on the website. It's a soft rollout, so you can gradually start using those as part of your practice for applying and reapplying for your clients. And know that the big thing in harmony with this is you need to file 2 separate application notes, okay? One for NFLOC and then one for CFC, right? So that's the big harmony piece to that. We also have the rollout of the late plan form. So something happens and you're turning in your support plan late, in your plan forms where you have your questionnaire, where the plan details form is, there's also a late plan form. This is going to be required as of April 1st. So there's guide instructions in your current guide from March. So that's on page 97. Last three quick points. Our Zoom office hours for training have been opened up to all providers, recipients, and their families. So if there are situations that come up where you would really appreciate some support in the training department, feel free to share the link to the office hours. They're Tuesdays and Thursdays, 2 to 4, except the first Tuesday of the month because we're here, right? And then finally, for CH for this session, we're going to email it to all attendees and we'll post the YouTube video of this session sometime in the next week. So that's all of our quick reminders. I love to transition over to you, John and Tony. Do you have anything that you'd like to, any screens you'd like to share, or how can I help you at this time?
No, thank you very much, and thanks for that great handoff. Tony and I just have some talking points that we want to go over. We actually quite a few, but really before I forget to ask, one, first of all, thank you for inviting us and allowing us to share some time with you. And as we do more of these type of engagements with you, one of the things that that the department, my boss is committed to is spending more time with groups such as this group. And so if there's topics that you want us or the department leadership to address in future meetings, certainly put it in the chat or send us an email message and we'll make sure that we do that. Because one of the benefits of the split is having department leadership have more time to focus on our providers and particularly our really important care coordinators, and making sure that they understand and are responsive to your needs, which will allow us all to better serve our the recipients that we all serve and support. So with that, if I could go into my talking points, but before I go in, Tony, did you want to say hello before I just dive into my discussion points?
Thanks, John. Just to say thank you for having us. We appreciate you all so much, and that we are here because we said we'd come back after that forum that we held last, I think it was December, with the Deputy Commissioner. We committed to trying to make a quarterly appearance with all of you, and that's what we're doing here. And it's good to be back with you all.
Yeah, thanks. And with that, again, if you have thoughts on future discussion items and who you'd like to hear from broader than just SDS, we'd certainly be happy to bring them to a future meeting. But first, the care coordination liaison position, that process, we have gone through the interview process. We're working with the state human resources to complete the hiring action on that, and hopefully that will be announced very, very soon of who's filling that particular brand new position. And again, thank you to the trust for funding this, and I think this is going to serve great purposes. And I touched at the last time I was here, I went over in some detail what the roles and responsibilities of this person are, but just big picture, there's increasing the number of care coordinators certified by SDS, serving both the rural and the urban areas, allowing individuals better access to choice and the important services that care coordinators provide. Work with you all to increase the ease of access to the Harmony database, and I know that we got work in front of us on that, and we're eager to get busy to improve that experience for you all. Increase timeliness by working with you and working with SDS to increase timeliness of the applications and support plans, and making sure that process goes as smoothly as possible. Working with our team and with care coordinators to increase the knowledge base of care coordinators, so that you all are aware of the opportunities to support our recipients. Topics could be, educating you on the 1115 behavioral health supports that are available, assistive technology, services outside of Medicaid. And these are just some of the examples of what the care coordination liaison position can work on. And as this person gains experience, I think the responsibilities and the things that they're able to achieve, I think, will continue to grow, and we're really excited to have that. The next item I want to talk on is nursing facility level of care and CFC applications. The new applications are now on the website and available for use. We greatly appreciate you, for the care coordinators who worked with SDS on the design of this and the testing of this new application, and we wouldn't be able to fill this product if it wasn't for the support and the partnership with our care coordinators who partnered with us on this application. And we've encouraged you all to begin using these new applications now, as they are shorter and more streamlined to complete. And we will be requiring those on September 1st of 2022. So we still got some time. So there's opportunity to get oriented to this new form and to gain experience with it before it becomes a requirement. And we want to give care coordinators adequate time to get used to the form. And so that's why we're making it available now. So please familiarize yourself with that form and let us know your thoughts and feedback. And that'd be a great process for the new care coordination liaison person to kind of oversee and get feedback on that, and to let us know how we could how that form is working. The next item is the change to the approval process for the non-emergency medical transportation. Recall that this was a big item of discussion that when we met in December. And following the forum back in December, and from hearing from you and your concerns, we worked with the department and healthcare services to provide clarification on that. And effective February 14th, requests for NEMT that come from care coordinators are no longer being approved. These are the responsibilities of the referring provider, as we all know. And healthcare services has provided communication to providers, again, reminding them that this is their responsibility. And by shifting the requirement and the burden to the providers, we're hoping that certainly helps with the transition and getting buy-in from the providers that this is their responsibility. This is a Medicaid service which allows for Medicaid recipients to receive transportation to or from medical and therapeutic appointments. And we're thankful that the care coordinators who over these years have assisted with that process. But I think it's certainly past time that our providers who have this obligation and responsibility can start to do that. And we did send out a message to care coordinators through our e-alert system on this. That was sent out on January 18th. And the medical providers will also receive communications from healthcare services, reminding them that this is their obligation and responsibility. Again, thank you for bringing this to continue to raise this important issue to our awareness and to our department leadership. And hopefully the new process will serve our recipients better and take over the burden away from the things that you've been picking up on. So, Appendix K flexibilities. As you were during the course of the pandemic, we have several flexibilities, and I'm still going to speak specifically of the Appendix K flexibilities. The Appendix K flexibilities are tied to the national public health emergency, and the Appendix K flexibilities, the flexibilities that we have can stay in place up to 6 months beyond the end of the end of the federal public health emergency. The division reviewed the flexibilities that have been allowed to our regulations under the public health emergency, and in partnership with you and other stakeholders, we've determined that several of those flexibilities we should keep and make permanent and we could do so safely without jeopardizing recipient health and safety. And the things that we want to make permanent, these include allowing a reduction in the number of required in-person visits between care coordinators and recipients on their caseload to every 6 months from the current process of every 3 months, and clarifies that the telephonic or other distance delivery methods of contact may be made in the subsequent 5 as opposed to 2 months. And so again, by allowing that particular flexibility, we think that that we could safely serve our recipients and reduce some administrative burden by shifting some of this to telephonic or virtual type visits. There are other flexibilities in the regs that will be welcome news, allowing electronic signatures on SDS documents, allowing certain home and community-based waiver services to be delivered using distance delivery within limits, and if improved in the support plan. The status of these regulations, so as you may recall that there was a public comment period shortly after the Christmas timeframe, and so the public comment period has ended, and so we're in the process of finalizing that regulation package, and it does take a little bit of time before they can move on to being approved. So right now, it's being finalized and sent around between the commissioner, Department of Law for final review, and we're hopeful that if everything goes smoothly, these regulations will be in place prior to the ending of the Appendix K flexibilities, and so that way we could have a seamless transition from the Appendix K flexibility to the new regulation package that would allow these flexibilities to continue. All right, big news on rebasing. So rate rebasing for care coordinators, home and community-based waiver services are underway right now. And so this is the first time really the new regulation that went into effect about 3 or 4 years ago has been applied with rebasing. We are providing technical assistance as we speak to the Office of Rate Review, who's doing the rebasing activity as they continue to work on this process to examine the rates that are in place. OR is getting a lot of input and feedback, and so are we. The department agrees that rates need rebasing, and the rebasing activities underway by the department are per the regulation. The new rates would be expected to go into effect on July 1st of 2022. However, based on the timeline, excuse me, it's possible that this work might not be completed. If that's the case, we're hoping to be able to make the rates retroactive, but we're working hard, and ORR is working hard to make sure that these rates, this rebasing process happens as timely as possible. And there's lots of interest in this from the legislature. We are getting lots of input and questions on how much rebasing is going to cost and what's the process. So there's a lot of interest in this. So I would encourage you, if you are close with your legislature, to keep letting them know how important the rebasing efforts are to you and to the people that you serve. I think again, the legislature is hearing a lot from the from providers and recipients, and I think there's a lot of agreement that rates, something needs to be done with rates, and the rebasing effort hopefully can resolve those issues. Okay. All right, other big news. As everyone's probably aware, Maureen will be retiring at the end of April. And so obviously we certainly are going to wish her well and miss her services, but she's fully earned the opportunity to retire. And one day I hope to consider myself a retiree as well. So we wish her well. But her replacement, we just announced to our SDS staff today that that the hiring process, are hiring a person by the name of Pam Kellish. And Pam comes from us from the Division of Vocational Rehabilitation, where for many years she served as the Northern Regional Manager for vocational rehab. And she's been responsible for the supervision of the regional office staff in what's called the Northern Field Office for DVR, providing DVR services to clients stretching across the interior, west to Nome, up to Yukiavik, and all parts northern. So she's got great exposure and experience in serving rural and interior and western communities, and I think that experience is going to serve her very well. And before she served as a before that, she served as a rehabilitation counselor, job developer, and a job developer, a transition specialist, a vocational manager through government and nonprofit agencies. Just a host of experiences, again, that I think will serve her well. She's got a master's degree from Western Oregon University, and so she's very well educated. And Pam's going to be based out of Fairbanks starting April 21st. So she's going to have a little bit of overtime with Maureen, which I think will help with the transition and making sure that that vast knowledge that Maureen has, that she's able to share some of that with Pam before she departs. But Tony, before did I miss anything? Is there anything that you'd like to add?
No, thanks, John. Thanks for making the announcement of about Pam. That's like John said, hot off the presses. We just told our staff a couple of hours ago, and we're real excited about that. We've kind of worked through the stages of grief about Maureen's retirement, past the anger and the depression, and now we're accepting that she's going to be leaving us, and we're really happy for her. I'm only kidding, of course, and we're just really grateful for the service that Maureen Harwood has provided to the state for 19 plus years, and we wish her well. And John, otherwise, no, that's it for me. You covered everything, and I just wanted to point out that again, really thank you for the feedback you gave us in the last sharing time we had with you, because that really helped us prioritize some things. We were really pleased that we were able to address the transportation issue. We've been able to convey to the administration and to the Office of Rate Review the importance of rates being looked at, thanks to that conversation. Driving through on the Appendix K flexibilities and getting as many good ones as we could into regulation, also important. And then the care coordination liaison. We're really excited to have that position here to serve as a resource for care coordinators. We kind of divide now our assistance to you among different groups. Our training unit, our great training unit, of course, our research and analysis unit, our policy team, the commissioner's office, the director's office staff. So we're really hoping that this is a resource for people. Right now I'm showing my daughter around to some colleges, and it's so wonderful that colleges now have an admissions office where we can go, we can start there, and they will help us, and we don't have to struggle about where we ought to go to the university. That's sort of the idea here with the care coordination liaison, is that we'll have a central resource for all of you, and that it'll just make things easier for you to understand. It'll make things easy for you to understand all things SDS. So thanks, John, and I'm really just eager to listen. Questions would be great, but really we are here to absorb further concerns, hear how the transportation issue has gone, if there's follow-up that needs to be done there. I'm just looking forward to listening as much as we can.
Awesome. I do have some questions that have come in on these topics, so I'm hoping to just go ahead and start working through them with you all. And for those of you, again, if we don't get to your topic or your comment, know that they're going to get it, okay? So if we don't cover it in this session, John and Tony will get the full list, so it's all right. So the first one was actually from Abby about the care coordination liaison. She'd like to suggest that the CC liaison had a Zoom office hours like the training team, because it's nice to be able to log in and talk to a person face to face. Do you have any info on that?
Well, first of all, yeah, thank you. I think that's a great suggestion, and the person's going to be reporting to Caroline, and Caroline is, as you know, is very eager to have this particular person be successful and the functions be successful, and I think that's a great suggestion, because we're going to expect the care coordination liaison to have frequent and routine conversations and discussions and be accessible to care coordinators.
Awesome. And our team knows that we're going to be working closely with that person. So it's highly, like, I don't want to put any, we can't shape anyone's work yet, but highly likely that they would be collaborating in office hours and in that process. So definitely good thoughts on that. And we're now
Yeah, that's a
moving.
great suggestion.
Yeah, so thanks, Abby. I have a couple of questions about or comments on Nemit from Robert and Ed and a couple of other folks. And first of all, it's very appreciated. Robert says, sincerely appreciate this recent change. So appreciative of that. And then Ed and a couple of other folks were asking about the letter, the official letter that was sent to providers. Where was that located? And I believe, was that circulated through e-alerts? Am I?
Yes.
No, I don't think what was the letter that was sent to providers, because I think that went out from healthcare services to providers.
Okay.
But we did. I think we did. I think we did. If we didn't provide a link to the letter, John's right. That's healthcare services purview. So I'll have to go back and look at the e-alert to see if we included a link to it.
I thought we did, but again, that went out in January, so I can't remember exactly what was on that e-alert.
I'll take a look. I'm looking up I'll look it up right now. I'm looking in the archive. But there was a couple of other comments that while I'm searching for that about this that they had some questions on. So let me scan to those. Oh, go ahead.
No, I found the e-alert already. It was put out on January 18th, and we did include a link to that letter in the e-alert.
Thank you, Tony.
Yeah.
Awesome. So
and the next question is, what do we do regarding a provider who won't arrange transportation for a client? That's from Mr. Smith.
Yeah, and I appreciate that question. I was wondering if any feedback on that today, because I was eager to hear whether it for some of you it sort of moved the problem to another place because the providers just wouldn't follow through on their responsibility. You should let Liz LaRue at the Division of Healthcare Services know about a particular provider who is not stepping up and assuming that role. Liz LaRue is liz.larue@alaska.gov.
Yeah, thanks, Tony.
All right.
So we have another question here. It said they're just curious if the care coordinators will be impacted by the DHSS split.
Great question. Yes, you'll have greater access, as I was saying, greater access to the department leadership. If you think about it, our department leaders, their scope and responsibilities with the split and really is being cut in half, and so they're going to have double the time to work on issues that are important to our care coordinators. There's not going to be any direct or any change in how SDS operates. The divisions that are staying with the Department of Health aren't changing. The thing that is changing is that we all have double the access to department leadership now to work on items that are specific to our Medicaid recipients. And so over time, you're going to see greater responsiveness and greater focus from the department on things that are important to you and our recipients. And so that's going to be the impact is things that in the past with the department focused on both the Medicaid programs and overseeing Medicaid programs such as SDS and behavioral health. They also had the Alaska Psychiatric Institute, Department of Juvenile Justice, OCS, the Pioneer Homes, which are operational. And if you're thinking about operational issues, those things that happen there become urgent fires that need to be addressed immediately. Where things that we work on typically are strategic, requires long-term planning, a commitment and focus on those type of things. And so since they're being freed up from those urgent things that always are drawing them to these operational sides, they'll have the greater ability to focus strategically and have a greater focus on items that are important to us and to you and our recipients. But great question. Really good question. A lot of people are asking that. And there is a reorganization website. Tony, probably we should send out an e-alert that alerts all of our recipients of the reorganization website. But if you wanted to look, if you go to the DHSS website, there's a link to the reorganization website. The reorganization website is updated on a weekly basis, and it provides real-time information to providers and recipients, and also that state employees as well, of what's happening with the reorganization, and and there's links to frequently asked questions and a host of other resources related to the reorganization. So, great question, and you're right. We need to provide more information, and the department will be going through a series of communications to providers and recipients, and so expect to see future e-alerts on guidance and things as things are developed. But thanks for the pulling up that reorganization website. Again, there's an overview, there's resources, frequently asked questions, there's recorded town hall meetings, and so a lot of information there. And this website here is expected to grow in items that are on there based on as people ask questions, et cetera, and as processes are being developed by the department in support of the reorganization. It's all going to go here.
All right, so our next question is, can you please clarify the proposed care coordinators visitation regulations? Is that for all waivers? You mentioned changing it from 3 to 6 months visits. Only ISW currently is every 3 months visit. Thanks. And if so, when is this set to start?
Yeah, great question on when is it set to start. Let me tackle that first, and maybe Tony can help me out with some of the other details here. But the Appendix K flexibilities, I just want to provide context because I can't really answer the question of when is it expected to start. But context, I think it's important to understand the context of the timing of this. The public health emergency is a federal public health emergency. The Appendix K is tied to that. The Appendix K flexibility allows for a lot of this. And the Appendix K flexibilities can be in place up to 6 months beyond the end of the pandemic. It's our hope and intent and our desire, and we're working hard to make this happen, that the regulation, the flexibilities made permanent regulation package will be in place before the Appendix K flexibilities expires, and we think we have a pretty good shot at making that happen. But will there be a lapse? Will the Appendix K flexibilities end before the new regulation goes into effect? That's possible. But if that does happen, it might just be for a few months. But we are working with State of Alaska leadership to try to expedite this particular regulation package so it's in place prior to the end of the public health emergency. And the Appendix K flexibilities that are tied to that. And Tony, can you help me out with some of the technical issues?
I hope so. Yes, the Appendix K flexibilities do apply to all waivers. We will offer you further clarification at upcoming office hours on details around the Appendix K flexibilities. However, yes.
Thank you. And Tony, let's go back and read that question and make sure we answered it correctly. If not, if we need to provide additional detail, we'll come back and try to provide that.
Do you want to reread it? Oh, we can reread it again. So can you please clarify the proposed CC visitation regulations? Is that all waivers? You mentioned changing it from 3 to 6 months. Only ISW currently is at a 3 months visit. And when is that set to start?
Yeah, we've addressed the set to start time. So yeah.
So if I'm right about this, the reason that the other waivers are at 6 months is because they're enjoying the flexibility of under Appendix K. What's going to be different is we're going to permanently install that allowance in regulation, if that makes sense. So yes, we're currently you have a 6 month contact window, but that's an Appendix K flexibility that we are going to make permanent into regulation, so that we don't have to go back to the the every 3-month expectation. I hope I'm accurate about that.
And this is,
I know.
and this, yeah, this is Maureen, and I'll just jump in just to, the division recognizes that the schedule and choices under the ISW are different in terms of TCM, targeted case management. So as this goes on and when the final regs come out, we will definitively make clearer the distinctions and which choices these have in terms of care coordination. But it is correct to say that the ISW already had a different sort of contact requirement around care coordination, and we're helping to just equalize the playing field and give more access. So hopefully that answers, but Delight and Cassandra will be definitely offering lots of trainings when the flexibilities come out permanently. Sorry guys, didn't need to jump in.
No, thanks,
great.
Maureen.
Thank you.
No
We'll
problem.
miss
Thank
you jumping in, Maureen. We're going to miss that. So also kind of in that line of thought, there were questions about electronic signature requirements that we answered in the chat that we said further guidance is going to come out as these become more finalized. So the closer we get towards finalization, we're going to prepare you for those changes. So, but these are great questions to ask, and we're capturing them all. I have a couple of others here. One of them, let me scoot down here a little bit. Is there an SDS organizational chart for all employees and their roles that we could have? It would be super helpful to get the info to CCs. And you all brought that up to us before, and so I just wanted to let you know that training team has started roughing that out, but we paused because there's a lot of things changing right now with the new liaison and with Pamela coming on board, Maureen retiring. So that's in the works. So your suggestion on that was awesome. There's another question here that
Before you go on, if you go to the SDS website, there's we have a an organizational diagram, and there's another document too that provides high level overview of what each unit does and who the point of contacts are there. So there is information on the website that does help people understand what each unit does, but it doesn't go down to each and every employee in SDS, but it's at the unit level.
Do you mean, and I'm showing my screen right now, so if you're not seeing it, let me know. The unit breakdowns here, is that what
it should be if you look at about us.
Contact us.
An Excel spreadsheet that we had that's been posted online.
Go. Yeah, do you see that who to contact at SDS?
Let's open it up. Let's open
Well,
it up.
that one.
Go down.
It's the other one.
Oh, sorry.
That's just we'll pause here for a second, Delight. This is just simply the high level management of SDS. It's not the detail on every employee, and it's also badly outdated. You'll see it's from October 2020, so there's been some reorganization since then. But go ahead with that. So that needs to be updated pretty significantly.
I think it's the link below that one.
This
Yes.
I do.
Okay.
Yeah.
I'm learning with you guys. So just so you know, this is thank you, John and Tony. So awesome. This is a really great resource.
Yeah,
so
I
it
will
breaks down the
see it.
teams.
Yeah, just scroll through that, Delight. That'll at least show you the managers of every unit here at SDS and what kind of questions and topics they can field. And I think it's fairly. We put it back. We put it up when the cyber attack got behind us, and we were able to put our website back together. So it is pretty current.
Okay, I'm dropping this into the questions box, a link, and sending it to you all. So
that's a great question too. Yeah. It's a great question, and this goes, and again, it doesn't go down to the individual employee level, but it goes to the unit level and describes each of the unit's responsibilities, functions, at a high level. So yeah, I think it gives you a good head start of who to contact.
And that's best practice, guys. If you have a case question, you're not ready to submit something, but you need to talk to that team, start with the unit manager, and they can talk you through some of the logistics, or they'll defer you to someone, okay? As many of you know, when you come to training office hours, we often defer you to the right team when it comes to certain questions. So a couple more questions coming in. So let's see. And Cassandra, you're probably reading ahead of me. So if you see some, feel free. The next one that I have here is about assisted living homes.
Yes, I was gonna skip that one, but go ahead. I think that question is for someone else, but maybe John or Tony may want to try to tackle that, or could defer to where it may be. When assisted living home, wait a minute, when will assisted living homes that serve ALI waivers have regs and rates updated? Presently, they do not have to take clients into the community or to the doctor, and many older people do not have natural supports and are not accurate reporters due to memory issues. Make sure I'm not missing anything else. Okay.
Just we can't see the questions just by, I don't know,
okay.
I can't anyway.
Okay, I'm gonna reread it for you because it was kind of small. I had to make it bigger so I could see it myself. So I do apologize.
Besides the question asked about regs and rates, the rebasing effort are underway right now for the rates, and so that will be addressed with the rebasing efforts. And Tony, I don't think we have any current reg projects addressing that specific issue that was addressed.
No, you know, I hear that the sort of the way that question washed over me was a concern about the resources that are out there and the lack of, and we get it, we hear you, and that's one reason why John brings up the rate rebasing, because we know that will be a key to getting more providers into the pipeline, and that in turn will result in more kinds of providers that are out there to serve folks. I'm going to use this as an opportunity, John, to talk about a bill that's in the legislature that we're very excited about, and that we think will be good news for people serving seniors. And I can go ahead and defer to you, John, since I know you're as excited about it as I am.
Yeah, just a high level, thanks. And that's the bill is called SB or Senate Bill 98. It was initially proposed last year, and it's being rebranded. It was initially proposed by the governor as adult foster care, and the idea was to create a new setting and a new license type that's light. So it's a settings and a license type that's less onerous that would allow individuals who are in child foster care to age. And if the individual and the family that they're in as a child foster care were willing, that they could transition into that same home into what's called adult foster care. When this was presented, the legislature asked, well, could this be expanded to be more broadly available to others that are aging out? And we've done a series of stakeholder engagement, and I think probably some care coordinators may have participated when we did stakeholder engagement with AADD and other associations this past year. But the feedback was, yeah, it could be expanded, and so it was reintroduced today, and it's expanded to include any adult who's on the waiver that with a residential component. Once this setting is created, can choose basically a family that's agreed to convert their home into a adult foster care. It's called adult home care is the new term, but it's going to create a new setting and a license type that's going to be a lot less onerous for the provider to establish themselves as this provider. But anyone who qualifies for the waiver could and that has a residential component to that could choose this particular setting. And we think that this will be allow residential supports to be expanded across the state of Alaska, because it's not going to have the same requirements as a group home setting. We think that that this will allow providers to be established in some of our more rural and off the road system to create this to open up these this particular setting and give an option to individuals who choose to live in an adult foster type arrangement. It's going to be called a adult home health, though. But go ahead, Maureen and Tony. Anything else you want to add?
Yes, Maureen, do you want to weigh in on this?
Yeah, I do. I like this question because it's always a good place, and we can use another office hours or stuff to talk about what do we expect a licensed home to do. Someone said talk about taking someone to the doctor or doing different things. So I'd like the opportunity, if we can, to take that component of the question back to our teams and residential licensing and make sure we're clear. But I do think there may be opportunities in the future for what can be expanded or offered or chosen. But we also want to make sure that you're right, basic health and safety and different things are met. So I appreciate that question, and I appreciate the information on the bill. But let us take that back and get a really good super answer for you about that, because I'd like to think about that a little more.
All right. Thanks, guys, for the good discussion on that. There's a couple more questions. So I am seeing a lot of questions about the care coordinator liaison position. A lot of folks are wondering about, a lot of folks are asking, was it posted publicly? And yes, it was posted on the job Workplace Alaska.
Yes.
So I'm just answering probably like 8, 9 comments that have been on that theme. So that's one of them. So there is a question about care coordinator rate increase. So is there a timeline for when the care coordination rate increase would occur? During AADD, members were told care coordination rate rebasing was separated from other home and community-based waiver providers rebasing, but they didn't make it clear if care coordination was not rebased in 2018 and 2020 with other providers. So looking for clarification on where does care coordinators get rebased in their role?
Well, first of all, no other agency provider type has been rebased in 18 or 20 either, so there hasn't been a rebasing for really, I think, since for the majority of the providers since about 2011 was the last time they were rebased. I know that care coordinators that was done at a different timeline. There's a different process for care coordinators, but I think what wasn't made clear was that it is a different process, but the rebasing efforts are happening simultaneously. Correct, Tony? Is that, yeah?
Yeah. I mean, there is a different, as John indicated, there's a sort of a different methodology that care coordination follows. Residential supported living also goes through this methodology, but we clarified actually just last week what services are being looked at for the rebasing, and care coordination is definitely one of them.
Yeah. So it's a different process, but it's the same timeline.
Yes.
Awesome, thank you for that. So this question's coming up. I'm seeing this one quite a bit, and so I'm hoping you can answer and clarify for this. Has there been a resolution to the third-party liability issue? Is that something that we're still going to have to address with our billing in the future?
Look at the e-alerts on that. We've provided very specific updates by e-alert. The only provider types that will need to follow the third-party liability process are specialized nursing. So care coordinators would not need to be submitting bills to third-party providers. But the full answer to your question, no, this is not done. There's still public comment that's going to come out on proposed change to third-party liability, and the state still needs to work with CMS to finalize it. But we did communicate which provider types and would need to go through a billing of a third party, and care coordinators are not among them.
Thank you.
Sorry, I missed anything on that. Great question, though. Great question.
Okay, so next question. Is there a plan to get certifications up to date? Provider certifications are lapsing and not allowing them to bill. So there was a couple of other comments too of care coordinators expressing that there was a lag in certification processing. So I just wanted to bring that up since that's been a common theme in our chat so far.
Yeah, so send us that question and we could have that addressed and get a response. I'm not aware of that particular issue. So if that's happening and people aren't able to bill because of a lapse in certification, I want to make sure we address that. But make sure that we get that question.
Okay, so I'm just giving you all a time check that we're at 10 minutes and I'm scrolling through your questions and trying to capture as much as I can here. Looking for a couple more. There was a question about when AppKs are accepted. How far are they accepted to? There's been some confusion on that. What's the drop dead date on AppK was one of the questions that we had in here.
I think Maureen could help us with that, John. She's kind of been more closely tracking the timelines around submission of plans. Maureen, I hope you'll do this after you retire too, sort of just drop in out of the blue and help me out when I need it.
So again, we have the 6 months after the PHE, and the PHE right now is in the place where it may or may not be extended. So I think, and I'm actually going to have to rely on Delight and Kat and other folks, but I think we've been saying that we'll accept the AppKs. Oh gosh, I am embarrassed when I'm going to have to take a minute because I think we've been saying through September 1, but we changed that date. We try to, I have to pull up the last alert on the barrels. See what happens when you're going to retire?
Yeah, and that's kind of a trick question because we don't know when the, it's tied to the public health emergency. And no one knows when the public health emergency is going to end. The feds promise that they'll give states at least 60-day notice before the public health emergency ends. And so that notice hasn't come out. And so, really, so it's always tricky too. If the feds are always moving the end date of the public health emergency, I think care coordinators have seen this. Every time there's an extension in the public health emergency, we have to send out a new e-alert, adjusting the timelines. And so we're kind of, needing to follow the lead of our federal partners on when the public health emergency is expiring.
Yeah, and also too with that, I think in the past when we were really clear, we've been working on the short form, we've all been calling it, and the rollout there, we've been saying you can use the AppK or until the short form comes out. So we're trying to sort of, like John's saying, hedge all the information that we have at our fingertips and make sure we have the right date. I think it's like, see, here we go. Appendix K flexibilities would end October 22nd. I'm reading, somebody sent it and we're just waiting. So
that's if the public health emergency ends in mid-April, I believe, right?
Which
October, which is 6 months.
The feds have already said it won't, but I mean, they have to extend it, and it's not our authority to extend it. But they did say that they would give states a 60-day notice before it ends, and so they won't, unless they break their promise, it's not going to end in April.
Well, and just so you guys all know, we're going to make it a really big deal when AppK goes away. Like, it's gonna be, we're gonna be throwing up some billboards. It's gonna be made into a really big deal. So just know that we're not gonna just suddenly, because we also understand how much time it takes for you to do these planning meetings. You're working so far out ahead to coordinate with families, find out, do we want to keep the services the same? Do we need to request a full plan? We understand that and respect that. So we are going to do our best to keep ahead of when AppK is going away. It'll be, I promise, there will be trumpets, there will be fireworks, you will know.
Yeah. And this happens every 3 months. And so every 3 months since the start of the pandemic, and so case in point, I think it's April 15th is when the current one is a scheduled date end. In every previous incident, it was the day of or the day prior that the feds extended it by another 90 days. So we probably won't get a communication until, I'm not sure what day that April 15th is, but it'll probably be on the 15th or maybe the day prior that we get notice from the feds that they've extended it for another 90 days. That's how it works, and we don't control that.
Yeah, so it's going to be a ways out. A lot of good comments and feedback still coming into the chat, so that's awesome. I think we're kind of at the last final thoughts for the next 5 minutes. A couple of questions while we're on the topic of AppK about the short form, of where that's at, any new information on that process. So I think you touched on it a little bit when you were talking about flexibilities, but just kind of a regroup on the short form.
Yeah, it's the same thing. You know, we're working on it and it's sort of ready. When we've been, we piloted it and some of the care coordinators gave us lots of information, and then within Harmony, and we're trying to feel the timing because we want it to feel right in terms of that kind of thing. And like Delight said, we know we give a lot of lead time for the training and when things are doing it. So we were looking at some of the other things we were rolling out and trying to, again, get that feel for when the public health emergency will end, so that we don't have too many things going on. So it's not like we're hiding it. We definitely showed it, and we'll be showing it a lot more. We definitely took the feedback that people put in, and Delight, I'll give you a more definitive answer in terms of that, in terms of next week. The public health emergency, or the week after, will be extended, and then we're hoping to plan around that for which forms we're going to use and keep going in terms of information.
So we're getting a lot of shout outs to Maureen in the chat, of people
Now you're
being
talking.
like, Maureen's amazing. And a big thank you for your years of dedication and service, Maureen, and really appreciate you and all of your efforts to make this a more person-centered bureaucratic process. We really appreciate you, and we'll miss you. So lots of people are giving their shout outs there. And a lot of folks are saying thank you for connecting in, John and Tony, for being available and joining us today to field all these questions. Some of them you were warmed up for, and some of them you aren't. And that's part of the fun here, guys, is that this is real. We want to be welcoming to your feedback, because we won't know, we won't grow unless we hear it from you. So thank you for that. Know that we're going to be processing this. This is going to be turned into a YouTube video. So if you have colleagues that couldn't make it today and want them to check it out, it'll be on our YouTube, the training YouTube channel. You should subscribe to it for whenever we post things. And then I am seeing several questions about the late form, the late plan form, and people asking, is that online? That's a Harmony form, pure Harmony form, okay? It's not on the approved form, it's in Harmony. So please go to your guidebooks for that. Or better yet, just come to office hours on Thursday and I'll give a walkthrough with you on it, okay? It's a pretty straightforward one that we went over. Oh gosh, I think we covered a couple of months ago in an info share. So it's not scary. It'll be okay. But we're at time. Any final thoughts, John, Tony, Maureen?
Yeah, really, we want to know what subjects you want us to touch on, or if you want us to bring expertise, maybe someone from ORR to talk about the rebasing process, or somebody to talk about license. Those are just examples. So submit your desires of what you want us to address at future meetings, and based on the feedback we get, we'll work hard to make sure that we have a meaningful presentation and dialogue at our next meeting, because we want this to be meaningful to you. And so in order for that to happen, we need to know what it is that you want us to talk about. But Tony or Maureen?
I just want to say, Delight and Cassandra, you guys are amazing. Thank you for the coordination of this, but just thank you more for just who you are. You're just so you're just so you guys all know the word that wants to trip off the
Just
tongue
say
when you're
it.
talking
Just
about
say it.
the
I
live.
can always
Just
tell
say
when
it.
someone wants to say it, but they're holding back.
So, and people should go to, if they're going to Full Lives, Delight will be doing a presentation with Cassandra's help, and be sure you check it out.
And Tony's going to be
And-
presenting too, and John. So there'll be a lot of cool, familiar faces.
Yeah.
And get those CHs.
Yeah,
I think it
and
will,
I just want to say thank you to all of you. It has been an honor to serve, and Care Coordinator has always been my very favorite aspect of our service connection. So thank you all. Thank you.
And everyone, please start emailing us now if you have signed up for Full Lives, so I can get you onto my data sheet. And that way I won't miss you when it's time to send out your certificates.
yes. So
And-
we're going to go ahead, but we'll leave the chat open for a while. We'll turn off our cameras and turn off the commenting. And if you can just put in more feedback if you'd like, just if you need to, or you can sign out. We're done. But thanks, guys. Thank you for all that you do.
It was
And
fun.
Delight, we put the e-alert. I sent it to your regular email that has the dates, so you can pop it in the chat.
Perfect. Thank you.
Thanks, Cassandra.
Thanks, Delight. I've got to get to the next thing.
All right. Thank you, everybody.
Bye.
Delight, I'll close out once I see we're down to really no one in here. Okay.
Okay, sounds great. Thank you.
Delight, are we gonna open up what you call?
No, I don't
Office
think
hours?
so. I don't think we need to today. But we can go ahead and shut this down, I think, at this point in time.
Yeah.
And we can start getting a
I got
YouTube
only 8
video
people
ready.
left. I was just making sure there wasn't It wasn't trying to log in. Okay. I'm going
Yeah,
to close it down for everybody.
sounds good. Thank you.